breast cancer prevention. We all want to stay healthy, feel empowered about our health. Breast cancer, it's a big concern, right? Especially for women, but it's also an area where prevention, or at least, lowering risk, maybe influencing outcomes, it's being actively studied a lot. So for this deep dive, we've gathered quite a bit. Everything from core info from the National Cancer Institute.
Right, the official sources.
To detailed scientific reviews, even data and commentary from major clinical trials, big studies.
Yeah, real mix.
And our goal, as always, is to sift through all that, pull out the key knowledge, and just give you a clearer sense of what breast cancer prevention actually looks like today based on these sources.
Let's do it.
Okay, so maybe first, let's just unpack that term, prevention. When scientists talk about preventing cancer, what are we actually talking about?
Fundamentally, it's about taking steps to lower the odds that cancer will even start. That's the individual level. From a public health view, the aim is to reduce the number of new cases showing up in the population.
Right.
And the ultimate goal there is, of course, to reduce the number of deaths from the disease. It's also really crucial to remember cancer isn't just one thing. It's a whole group of diseases, really complex, and your personal risk. It's always this unique mix. Your genes play a part, your lifestyle, your environment, it all feeds in.
So it's not just one cause, one solution.
Exactly. And that's why researchers look at both risk factors, things that, seem to increase your chances, and protective factors, things that might decrease them.
Yeah.
Some risk factors, you can avoid them. Smoking is the classic example for cancer generally.
Sure.
But, and the sources are clear on this, many risk factors for breast cancer. You just can't avoid them.
And the sources we looked at cover a few different ways scientists are studying prevention then.
Yeah, several angles. They look at lifestyle changes, diet modifications, avoiding known triggers or causes. Then there's using specific medicines, kind of acting against those early changes or blocking cancer formation.
Medicines, right.
And sometimes, for people at really high risk, even risk-reducing surgery comes into play.
Got it. Before we get into all those factors, maybe just a quick baseline. What is breast cancer? Very simply.
Sure. So think of the breast tissue. You've got glands, the lobules that can make milk, connected by tubes, the ducts, and that's all sitting in fatty tissue. Cancer is when cells in those tissues, they just start growing uncontrollably. They form a tumor, a malignant one.
And it's significant.
Oh, definitely. The sources, like that NCI data from May 2025, they confirm it's still the second leading cause of cancer death for American women.
Wow. Second.
Yeah.
So let's get into the really interesting part now. Unpacking what drives that risk. Yeah. What factors did the sources consistently point to for an increased chance?
Right. And some of these are, unavoidable. They're just major factors for a lot of people. The biggest one, really, apart from just being a woman, is simply getting older. Age.
Age, okay.
The sources give a pretty stark example. A woman who's 30, her chance of getting breast cancer in the next 10 years, it's about 1 in 175.
Okay, seems low.
Age is a major driver. Also, your personal history matters. If you've already had invasive breast cancer or certain precancerous conditions like DCIS or LCIS, or even some specific types of non-cancerous benign breast diseases, that puts you at higher risk for new breast cancer later on.
Makes sense. And family history, genetics.
Absolutely. Having a close relative, mother, sister, daughter with breast cancer bumps up your risk. And then there are specific inherited gene changes, like in BRCA1 or BRCA2. Those are the well-known ones.
Right.
Having one of those can significantly raise your risk, though, the exact level depends on the specific mutation, your family history.
Yeah.
It's complex.
Okay. Any other unavoidable ones?
Dense breast tissue. That comes up consistently in the sources as being linked to increased risk.
Interesting. Now, you mentioned hormones earlier. A lot of the factors seem tied to estrogen exposure over a lifetime.
That's a really key theme in the sources, yes. Factors related to your reproductive life that lead to more total years of estrogen exposure tend to increase risk.
Oh, so?
Well, starting your period early, say before age 12, that means more years your breast tissue is exposed to those estrogen cycles. Same idea if you start menopause later, more years of cycles. On the flip side, things that interrupt those cycles, like pregnancy, if you have your first full-term pregnancy later, maybe after 35, or if you never give birth. That means, compared to someone having kids earlier, you've had fewer breaks in those lifetime menstrual cycles, so potentially more overall estrogen exposure.
I see. And what about hormones taken for menopause?
Good point. Hormone therapy, or HT. The sources specifically flag combination HT, that's estrogen plus progestin, as increasing breast cancer risk.
Combination specifically.
Yes. And importantly, the sources also note that when women stop taking that combo therapy, their risk does start to go back down.
That's good to know. Okay, what other risk factors came up?
Radiation therapy to the chest area. Say if someone had treatment for lymphoma when they were younger,
Right.
that increases risk, and the risk seems to start showing up maybe 10 years after the treatment. It's particularly higher if the radiation happened during puberty when the breasts are developing. And the sources also mention something interesting for women with those BRCA1 or 2 mutations,
Yeah.
that even lower doses of radiation, like from diagnostic chest x-rays, might increase their risk further, especially if they had those x-rays before age 20.
Okay. Anything else?
Obesity comes up, particularly for postmenopausal women who aren't using hormone therapy. That's linked to higher risk. And alcohol. The sources are very consistent on this one.
Alcohol.
Yes. Drinking alcohol increases breast cancer risk, and it's dose-dependent. The more you drink, the higher the risk goes.
Okay, that's pretty clear then. So that covers a lot of the things that increase risk. What about the other side? What do the sources say might decrease the chance? The protective factors.
Right, the flip side. And again, reproductive history plays a role, but in the opposite direction.
How so?
Factors linked to less lifetime estrogen exposure seem protective.
Yeah.
Like having a full-term pregnancy relatively young, the sources mentioned before age 20 specifically, that seems linked to a lower risk compared to never having children or having them much later. And breastfeeding. That also seems protective for women who've had children. Part of the thinking is it might help keep estrogen levels a bit lower during that time.
Interesting. Okay, what about medical things? You mentioned medicines earlier.
Yes, this is a really important area, especially for women known to be at high risk. There are drugs called SERMs, selective estrogen receptor modulators.
SERMs, like tamoxifen.
Exactly. Tamoxifen is one, raloxifene is another mentioned. They're clever drugs. They act like estrogen in some parts of the body, which can be good, like for bones maybe.
Yeah.
But crucially, in breast tissue, they block estrogen's effects.
Wow.
And the sources show these can significantly lower the risk of developing certain types of breast cancer, specifically ER-positive cancer, and DCIS in women identified as high risk.
For both pre- and postmenopausal women.
Tamoxifen can be used for both. Raloxifene is
Yeah.
generally used for postmenopausal women for prevention. And interestingly, the risk reduction seems to last for years even after you stop taking the drug.
Wow. Okay. Are there other types of drugs?
Yes, another class called aromatase inhibitors, or AIs, drugs like anastrozole, letrozole, exemestane.
Aromatase inhibitors.
Yeah.
How do they work?
So after menopause, most estrogen isn't made in the ovaries anymore. It's made in other tissues, like fat tissue, by an enzyme called aromatase.
Right.
These drugs block that enzyme, so they drastically cut down the amount of estrogen circulating in a postmenopausal woman's body.
I see. And they're used for prevention, too.
They're used to lower the risk of cancer coming back or a new cancer starting in postmenopausal women who are already considered high risk. Maybe they've had breast cancer before, or they're over 60, or had DCIS treated with mastectomy.
Got it. And what about the surgery option you mentioned?
Right. For women at very high risk, often because of those BRCA gene mutations, risk-reducing surgery is discussed. One option is a prophylactic mastectomy.
Removing the breasts.
Essentially, yes. Removing as much breast tissue as possible to dramatically lower the chance of cancer developing there. Another surgical option, particularly for high-risk premenopausal women with BRCA mutations, is removing the ovaries. Ovarian ablation.
Removing the ovaries because they make estrogen.
Exactly. Before menopause, ovaries are the main estrogen factory. Removing them causes a big drop in estrogen and significantly lowers breast cancer risk.
But that sounds like a major decision.
Huge. The sources really emphasize this. It triggers immediate menopause with all the symptoms like hot flashes, potentially quite suddenly. And there are long-term effects too on bone health, sexual function. So it needs very careful counseling and consideration. It's not a decision taken lightly.
Definitely sounds like it.
Yeah.
Okay, any other protective factors? Lifestyle.
Yes. Back to lifestyle. Regular physical activity. The sources consistently link being physically active to a lower risk of breast cancer.
Exercise. Always seems to come up for general health, too.
It really does.
Okay, let's switch gears a bit to diet and nutrition. This area. Well, it always feels like a minefield, doesn't it? Studies seem to say different things all the time. How do the sources help here?
Yeah, it is complex, no doubt about it. But the sources do help pull out some clearer signals amidst the noise.
Okay.
First, alcohol. We mentioned it as a risk factor, and the diet sources confirm it. Definitely, drinking more alcohol equals higher risk. That's consistent.
Right. Clear message there.
Now, for the rest of diet, maybe instead of getting bogged down in every single food study, the sources seem to highlight something potentially more powerful.
Which is?
The impact of overall eating patterns, and maybe less about preventing the cancer from starting in the first place, and more about influencing the outcome if it does occur.
Outcome versus incidence. Can you explain that a bit more? That sounds important.
Yeah, I think it really is. One of the standout findings, highlighted quite a bit in the material, comes from a really big long-term randomized study. The Women's Health Initiative, or WHI, Dietary Modification Trial.
WHI, okay. I've heard of that.
Right. They studied postmenopausal women. One group adopted a diet that was moderately lower in fat. As a result, they also ended up eating more fruits, vegetables, grains, and they lost a bit of weight.
Okay. Sounds generally healthy.
Pretty much. Now, here's the key finding. This specific diet change over about 8 or 9 years didn't significantly reduce the number of women getting breast cancer initially. The incidence wasn't strongly affected.
Oh, okay.
But, and this is the crucial part emphasized in the sources, especially when they followed these women for much longer, nearly 20 years, that same dietary intervention was linked to a statistically significant lower risk of dying from breast cancer.
Dying from it? Wow. So it didn't necessarily stop it from starting, but it seemed to affect how serious it was or the long-term outcome.
That seems to be the implication highlighted from this major trial. It's a powerful finding because it comes from a randomized study looking at a lifestyle change and showing an impact on mortality, which is quite rare and significant.
That really does shift the perspective, doesn't it? Away from just, did I prevent it, to how did my lifestyle affect the outcome?
Exactly. And it helps make sense of some of the other dietary findings that can seem confusing. Like, the sources mention studies on dairy. Some suggest maybe low-fat dairy is good. Others worry about components in dairy that might increase risk. It's mixed.
Right.
Same with maybe red meat or soy. The evidence on individual foods is often complex, maybe context-dependent.
Yeah.
But this WHI finding points towards the potential benefit of an overall healthy pattern. The sources do mention other dietary points, of course. Some reviews find links between higher fruit and vegetable intake and lower risk. Others flag trans fats as potentially bad for mortality. Maybe dietary cholesterol or red processed meat having slight associations with increased risk in some analyses.
Okay.
But the highlighted result, the one really emphasized from a strong study design, is that WHI low-fat dietary pattern being linked to better survival, lower breast cancer mortality.
So the big takeaway on diet isn't necessarily stressing about every single food item based on conflicting reports.
Probably not based on this evidence.
Right, but rather focusing on that overall healthy pattern. Lots of fruits, veggies, whole grains, keeping fat moderate might have a real impact, especially on the outcome if cancer does develop.
That seems to be a key message distilled from the sources, yes. And that pattern, of course, has tons of other health benefits anyway. The sources also briefly touch on nutrition during cancer treatment, managing side effects like taste changes or nausea, and also how nutrition after treatment is studied for affecting recurrence or survival. They mention the WHI trial again there, and a couple of others with varying results.
It really seems the focus in these sources broadens beyond just stopping cancer before it starts.
Absolutely. It's about incidence, yes, but increasingly also about outcomes. What happens if you get it? And interestingly, the sources mention researchers are working on prediction models, not just to predict who might get breast cancer,
Right.
but also trying to predict who might be more likely to die from it if they do get it, which again highlights that difference between incidence and outcome.
Fascinating.
And it circles right back to that WHI trial finding again. A lifestyle change potentially impacting mortality. That's a really significant point from the sources. They also briefly touch on screening, like mammograms. It's acknowledged as complex.
How so?
Well, screening definitely helps reduce deaths from breast cancer by finding it earlier. That's well established.
Okay.
But the impact on overall deaths from any cause is less clear. And there are downsides like overdiagnosis, finding cancers that might never actually have caused harm if left alone.
Right, the overtreatment issue.
Exactly. So the sources note it's a nuanced discussion, sometimes controversial, but the bottom line is major guidelines still recommend screening because of that proven benefit in reducing breast cancer mortality.
It sounds like this whole field is just constantly moving, constantly being researched.
Oh, absolutely. The sources make it clear. Scientists are always looking for new ways to prevent breast cancer, running clinical trials.
Yeah.
It's a very active area.
Okay, so let's try to pull this all together. After diving through all these sources, What does it mean for you listening right now?
Well, I think understanding breast cancer prevention means recognizing it's this complex mix, right? There are things you really can't change, your age, your genes, maybe some of your past health history. Those are significant factors. Then there are things you might be able to influence through lifestyle. Regular exercise seems pretty consistently linked to lower risk, maintaining a healthy weight, especially after menopause, being cautious with alcohol, and adopting that generally healthy eating pattern, like the one studied in WHI, rich in fruits, vegetables, whole grains, moderate in fat. That pattern shows up not just for general health, but potentially, as we saw, impacting mortality in that key study.
Right. Those lifestyle pieces seem important for overall well-being anyway.
Totally. And then, for people who know they're at much higher risk, maybe strong family history, known gene mutation.
Yeah?
The sources talk about those medical options. Preventive medicines like SERMs or AIs or even risk-reducing surgery.
But those are serious interventions.
Very serious. Powerful tools, yes, but with real side effects and long-term implications. Those are definitely conversations to have in-depth with a doctor weighing the individual risks and benefits.
So this deep dive, obviously it isn't medical advice. We're not doctors.
Not at all.
But hopefully, by pulling out these key insights from the range of sources, you feel a bit more equipped with knowledge about where things stand with breast cancer prevention research right now.
Yeah, having that information is always the first step, isn't it?
Definitely. So here's something to maybe mull over as you go about your day. Considering everything we've talked about, that difference between preventing cancer starting versus preventing death from it, the mix of unavoidable factors versus lifestyle choices and medical options, what part of breast cancer prevention feels most, I don't know, surprising or maybe most relevant for you to think about in your own health journey?